All right. By the end of this speech, my audience will be able to understand that psychotropic medications lack the proper testing and efficacy research to be prescribed to children and adolescents. There should be a pause immediately in the use of psychotropic medications on children unless there is an extreme case of schizophrenia or bipolar disorder. There is a potential long term risk to children and adolescents from these medications. According to Albert, we must accept the fact that these medications have not been long term tested. Approval was granted on short term efficacy trials, and as Americans, we value and trust the use of prescription drugs in our everyday life in America. I currently work with children and adolescents who have mental and emotional issues that are dealt with medications. Many of these take medications every single day that offer no cure. It's refill after refill after refill. I know of a 15-year-old client that takes at least on minimum 6 medications every single day. One medication to treat one mental illness, another medication to overcome the side effects of the first medication, and on and on and on. All to treat these counter side effects of the other medications. The current use of these psychotropic medications on children is unethical and should be stopped immediately. Parents should be informed of all the inherent risk associated, including the long term and short term side effects and the possible chance of addiction. Children need treatment plans and programs to treat their mental health issues. The use of medication has become a primary and preferred choice and should be included only with a comprehensive treatment plan. First, I'm going to explain how the medications being prescribed to children also impact adults. These same medications, according to Ayer, led to premature deaths and reduced life expectancies in adults anywhere from 10 to 20 years. And in that same article, Ayer explains that these drugs are effective in reduction of the patient's symptoms and they do increase functionality. So they do what they're supposed to do, but the long-term side effects are very damaging. Ayer's support claim is supported by the side effects that lead to an increase in cardiovascular disease or CVD. This new disease, so you go to the doctor, you develop cardiovascular disease, your primary care physician is going to prescribe you a medication to do what? Take care of the cardiovascular disease, not knowing what implications may come from the psychotropic medication you're taking. And a lot of the times you will increase your comorbidities, which could lead to that premature death or decrease in your life expectancy. According to McHugh, patients actually prefer psychological treatment over the pharmacology treatment. And this has been understudied. Many people don't like the impact that medication has on the way they feel or the way it makes them lethargic. So it's important to understand that we need to study a little bit more on psychological over pharmacology. Now, according to Psych Central, the top three psychotropic medications currently taken in 2020 were Zoloft, Lexapro, and Wellbutrin. Now, these medications treat either depression, anxiety, or they treat both. And according to Psych Central, the product uh, they produce the following side effects. Some of these aggressive behavior, anxiety, heartburn, hyperventilation, irregular heartbeat, suicidal ideation, and many more. Now that I have established that adults struggle with side effects from these medications, let us examine the impact that they have on children and adolescents. To understand the impact, we first must understand these medications received approval based on short term efficacy. I keep coming back to that because many of us would not accept, not know, if your drug or medication has not been studied properly and it hasn't been ran through the proper testing channels, we probably wouldn't feel very comfortable taking it. According to Albert, these medications lack the safety and ethical oversight needed to be prescribed to children. According to Ayer, a comprehensive database is needed that contains efficacy, safety, and adverse long and short term side effects. And based on my research, a complete moratorium is needed on the Concerta, Vyvanse, and Adderall, the top three ADH medications. These medications, these three medications I just discussed, all are Schedule II narcotics. If you got caught buying those on the street, you would go to prison for them. In the same article, Psych Central explains that these three medications combined accounted for $8.6 billion in revenue in 2020 for that company, those companies. I discussed I discussed Wellbutrin earlier and the impact side effects have on adults. And one of the things that they've noticed in children taking Wellbutrin in a short-term trial, they saw that it had an increase in suicidal thoughts in children and adolescents. So another reason why we should not be prescribing these to children. Also, according to Psych Central, the three medications used to treat ADHD, again, are considered Schedule II narcotics. This is due to their highly addictive nature. It's no different than taking methamphetamine or cocaine. And many of these, you risk developing a substance use disorder, an SUD, or becoming addicted to the product long term. These three medications also have side effects that include anxiety, constipation, high blood pressure, rapid heart rate, depression, skin disorders, and can lead to heart damage. Now, according to Schroen, the ethical use of these medications has not been discussed with the medical community. So a lot of these medications, there hasn't been an ethical discussion. Is it okay to give these to minors? The revenue there that they're generating is so great that they're not even concerned about the ethical reasons why they shouldn't give it to them. According to Smith, antidepressants are being prescribed by your primary care physician that does not have any pharmacology or any psychological training. But they have been given the ability to prescribe them if somebody goes in and says, hey, I don't feel good. I'm depressed. I'm kind of feeling anxious. The primary care physician is then prescribing these medications without a treatment plan to treat the actual underlying issue. It is unethical for the medical community to have relied on these short term efficacy results to gain approval for the use of these medications on children. Back to Psych Central and the ADHD medications that we talked about earlier. So when we look at the Schedule II narcotics, consider that these drugs are also Schedule II narcotics. Fentanyl, methamphetamine, morphine, opium, cocaine. So my question to you is, would you give your child methamphetamine? Would you give your child cocaine? Of course you wouldn't. But we continue to prescribe them medications that do the exact same thing. Some of these medications even have amphetamine in the name. So think about that. Remember the 15-year-old girl that I talked about earlier? Let's talk about her medications that she's currently taking. All of this information on the side effects I got from Psych Central. So the Vyvanse treats ADHD, and one of the side effects is increased blood pressure. Latuda treats schizophrenia and causes upper abdominal pain and nausea. Zoloft. Now, Zoloft treats depression, but there are some very serious side effects that can happen when you're using a serotonin. It's a serotonin release or uptick product. And you can get serotonin syndrome, which creates too much serotonin in your body, which can lead to death. If you get too much serotonin, you can die from it. So if you take more than is necessary, or if your body is not processing properly, it can kill you. The next medication is Olzampine. It also treats schizophrenia. Heart disease is one of the side effects. One of the side effects. And blood pressure, high blood pressure. Hydrozine treats anxiety and vomiting, and it actually causes altered electrical heart rhythm within patients taking it. It happens. It's not common, but it does happen. Lunesta treats insomnia. The last medication on that list is it treats insomnia. Why? Because all the other medications are elevating your alertness and all the other things. Causes a racing heart, nausea, and vomiting. So these 6 medications have over 100 different side effects that range anywhere from common to serious, with no age-specific warnings to the risk that it causes to children or adolescents with developing brains. One of the big reasons for the increase in prescription medication, according to AIR, is the lack of funding, the lack of therapists, and the lack of counselors. Um, that's led to the overprescribing of these medications as a frontline treatment option. A complete review of these medications is needed, and the above examples show that the overlaps in drugs used for treatment. I mean, in that example, there were two medications that were treating schizophrenia, and one treating depression, and one treating anxiety. We are all over the place and not able to treat this um, with just one medication. First, a treatment review. So now we're going to kind of go into what needs to be done. A treatment review on how medications gain approval. We need to understand how this medication is able to gain its approval for long time um, usage in children. We need to promote um, holistic and personal growth aspects between the patient, the client, and the counselor or the therapist. We're not using enough holistic approaches. We're using medication as the primary line of defense in a lot of our treatment options. According to Albert, there is a need for comprehensive animal research to determine what the long and short term impact on the developing human brain. A lot of this research was done short term, and we don't know the long term impact it has on a human brain as it's going through the developmental stage or adolescence. And according to Shenandoah, a new comprehensive approach is needed in treating mental illness that includes everyone, the patient, the family, the doctor, the school, and the therapist. And finally, additional research is needed to investigate the impact that biological differences have on the efficacy of the individual medications. According to Albert, that biological difference is what can tune in. So we can prescribe a medication to one individual that they may absorb the medication. It may do exactly the way it needs to work. There are other clients that may take that medication and it may not do anything. It may act like a placebo. Nothing happens. And then we can give it to a third patient, and they can store it up and it can build up and it can actually eventually kill them someday. We need to know the genome and how it operates within each individual person. So, in closing, it is easy to see how beneficial it would be for additional testing to determine the overall safety of these medications when treating children and adolescents. Modern prescription drugs are something that the average patient takes for granted. However, there are significant dangers that occur when using psychotropic medications in the treatment of mental health issues on children and adolescents. According to AIR, there is a clear concern when these psychotropic drugs are associated with premature death and the reduction in life expectancy in adults anywhere from 10 to 20 years. Next, these medications continue to be overprescribed and only utilize short-term and unethical testing models to gain approval. And then finally, again, Albert says that these medications must be safe for use, and if these medications are not completely safe and effective, then only the pharmaceutical company benefits from their use. And in closing, it is time to demand that these medications stop being used in children and adolescents until proper testing, research in both the long and short term can be determined the side effects on the human body. Albert states that this research has shown that these medications cause irreversible brain damage on research animals that are still in the developmental stage. While modern pharmaceutical companies are important in the prevention and treatment of diseases and infections globally, there is a debate on the efficacy, safety, and ethical approach being used in prescribing these medications to children and adolescents. The 6 drugs that the 15-year-old girl was taking account for billions of dollars in prescriptions and revenue for pharmaceutical companies. One 30-day supply of Zoloft is $1,858 per month. Now multiply that by the 1.64 million prescriptions, and you can see why the big push to gain approval was. Gaining proper approval for these medications will ensure that they are safe for the developing human brain, that they are effective in treatment, and that every parent knows the risk involved when the child is prescribed these medications. It is the ethical thing to do, and the pharmaceutical companies need to be held accountable for their lack of safety and ethical standards. Thank you.
Well done.